The other thing that was common was that all the doctors thought they were mad, you know. But the point is that they got well. So from here, we have to learn how to become our own placebo. So point number one, I need to become a new me. Point number two, I need to become what is called an epigenetic engineer. Epigenetics means above genes. So I need to change my genes by changing not only my external environment, but my inner environment. Now, what does it mean to become new? My personality creates my personal reality. So it's my feelings, my thoughts, my choices, my behavior which actually create it. And all this thing, because we have this huge memory bank inside us, my choices, feelings, behaviors are based on my memory. So if I drop those things and I become a new me. So that's number one, becoming a new me. Number two, becoming an epigenetic engineer. That means changing my internal environment to do that. Number three, mental rehearsal. Keep doing the mental rehearsal, becoming new people. Number four, and this mental rehearsal, must be done with heightened emotion, like gratitude, like joy, and things like that. And here, they say that normally we give gratitude to the things we already have. But what if we give gratitude to the things we don't have, but we are expecting to happen in the future? If I give gratitude to that, those things will actually, as quantum physics will later on explain, will actually become realities. And the fourth is to use my brain waves. Brain waves means that when we are in this state, when we are talking to each other, we are in beta rhythm. We have many waves in our body. So the beta waves are when we are active. Alpha waves when we are more relaxed. Theta waves when we are close to sleep. And delta when we are actually sleeping. So I need to come down from my beta into alpha to become better. And how do I do that? I have to stop that chatter in my mind. I have to stop looking at my email. I have to stop looking at my Facebook. I have to stop texting messages. I have to stop doing all those things. And if I'm constantly intellectualizing, I will never be able to get into this alpha rhythm. So I need to get into this, alpha rhythm to do that. So this is how you become your own placebo. Now, all these things, I hope I've been able to explain the power of the mind, how warts fall off, the spontaneous regressions of cancer, how an external stimulus will not affect my body, how I can change my immune system, how my biochemistry can change, how my autonomic processes I can control. Now, why is it that we go around this roundabout method? We place our trust on the placebo or on a healer or on a scalpel or on the deity. Why is it this roundabout method? Why can't we go straight there? It's because of the relationship of our will to our minds. The place in our brain where our will is very different from the place where these psychosomatic events take place. Human consciousness, especially ego consciousness that relates to verbal thought and will, are located in my frontal cortex. Whereas that part of the brain which mediates these immune system healings and these other healings are situated way down. They will respond to suggestions, but they will not respond to voluntary commands. So there is this communication gap between that part of my brain and this part of my brain. And all these methods that I've described are to cut that gap down, And that is how this will happen. So let me tell you a secret, a professional secret, is that we doctors actually don't do anything. We just excite the doctor within. So that is what we need to do. We need to excite the doctor within you. Thank you. Okay, so one very important part that we've missed out is the very powerful tools of visualization therapy, guided imagery, and affirmations. People have done amazing things with visualization, just amazing things. What is visualization? Visualization is just using your imagination to focus your attention into that part of your body that needs to be healed. Now we know through this neuroplasticity and these chemicals and things like that, if I visualize something on my hand gets activated, and that part of my brain which is controlling my hand also gets activated, right? So these biochemistry changes, the gene changes, the stem cells go up, my immune system changes. So visualization is a powerful process that is scientifically been shown to affect all these systems. What people started to do was that one method, becoming a mini me, that people visualized that they became very small and traveled down to this place where they had a fracture, And these many mini-me's came and sort of pulled the fracture together, and that is how they got well. This lady who had cancer, imagined there was a rabbit, which would come and nibble at her cancer every day. And when it goes to excrete that thing, and that place used to grow a lovely tree. So she gave that respect to that cancer also. Some woman visualized this healing water coming down her body, and then the first time it was black, then it turned brown, then it turned light brown, then it turned white. So this is her way of doing that. Some people have visualized cancer as little bubbles, and they go and poke these bubbles, and as the bubbles go away, the cancer goes away. Or they visualize cancer as a block of ice, and they wait for the ice to melt. I mean, these are real stories that people have used to heal. And you can do this for other diseases too. Like this guy who had this pneumonia, he visualized his pneumonia as pepper being thrown into his lungs, and he used a vacuum cleaner to clean up. And as he cleaned the thing, his pneumonia went away. Or people who treat arthritis by going down into that mini-me and putting this lubricating jelly. And so you can create your own movie. In this visualization, you are the writer, the director, the producer, and the actor. And you can go as, haywire as you want. You can use your imagination to do that. And now you know the science behind it, that when you visualize, what are the events that take place. Similarly with affirmations. An affirmation is a fact that you want to make real. So I make an affirmation, I keep making my affirmation, and those neural connections keep forming, and the healing takes place. So this is what is so amazing about the mind. Now, just wanted to do a few sort of breathing exercises and things like that. So, how many of you do yoga or pranayama or anything like that? You all do. Oh, wow. All right. So, before you start doing pranayama, what does pranayama mean? It means controlling my breath, basically, restraining and controlling my breath. So, first, those who don't do this must learn abdominal breathing. Okay, with abdominal breathing, basically I move my diaphragm down, my lungs expand. So I can first start by putting my hands on my tummy. What I do is that when I take a breath, instead of expanding my chest, I expand my abdomen. I blow my tummy out, okay? And then I take a complete yogic breath, which means I blow my tummy out, then I expand my chest, then I use my upper muscles to sort of take the full breath. Now it sounds like 3-phase, but when you're practicing it, it becomes 1. Pranayama, basically, the principle is that my expiration should be twice the size of my inspiration, always. So, and the retention. So I start with a ratio of 1, 2, and 2, which means if I breathe in to the count of 2, I hold to the count of 4, I breathe out to the count of 4. If I breathe in 3, I hold to 6, I breathe to 6. Ultimately, the aim is to make a ratio of 1:4:2. Then Bhramari Pranayam. You know Bhramari Pranayam, and yeah, you do that, and that basically is a very calming thing. It's also a cure for vertigo. It's also a cure for tinnitus. Then we have the Sitali. You know all that, Satkari. So you know all that. Bhastrika, all these things are various forms of pranayama. You can use your breath in various other ways also, like we did watching your breath. You can improve your concentration by just merely watching your breath. Or you can use your breath and count to 10 as you're breathing in and breathing out. You can use your breath to heal. You can use your breath for positive and negative affirmation. That means breathing in, I breathe in courage. Breathing out, I breathe out fear. Breathing in, I breathe in love. I breathe out hate. I breathe in forgiveness. I breathe out, the reverse of it. Or I use my breath to heal. It's a simple, again, a method of visualization that as I breathe in, I use this white healing breath to go down into my knee, which was hurting, and as I breathe out, I breathe the pain out. Then various other forms of concentration. It's too detailed to go into now, but Tratak, as you know, is another form of improving my concentration. Observation, like there are people who improve their concentration by looking at an apple, let's say, and looking at all the characteristics of an apple, then closing their eyes and trying to remember it. And third exercise is to sort of, recall what was happening. Visualization is different, is a little different, as is guided imagery. Like there was this patient, I was just talking to somebody patient of ulcerative colitis, talking to you. And, ulcerative colitis is a condition which which is ulcerations in the colon, which doesn't get cured, but it gets into remissions and gets into relapses. And I went into this session with this guy and asked him to sort of visualize his colon and start to talk to his colon, you know. And obviously the colon wasn't going to answer in verbal form, so it was giving him answers. And as we were doing this exercise, he first became very sad, then he became anxious, and then he became angry. And finally, he discovered that this actually happened 20 years ago. As a child, he was not allowed to express his opinion. He was always told to suppress his emotions. He wanted to be heard. He was never heard. Anyway, he went off to college and came back. He married a woman who was very similar to his mother, who didn't allow him to express his opinion. And he had to take a choice about keeping quiet or losing her. And that's the time when he got his ulcerative colitis. And once he came to this realization, he's now in sort of regular communication with his colon and working like that. So thank you for listening.
Ashok Hospital, you treat them with these alternative therapies rather than the...
No, actually my daily life is full of emergencies, and so I take care of emergencies in the way I need to. I mean, if a patient is bleeding, as I said, I'm not going to pray over him. But once they've come out of this incident, once they've come out of the ICU, once they've had their cancer surgeries, once they've recovered from their heart attacks, that's the time where we normally sort of explain at how they need to change to prevent this from happening again. But while they're admitted, anyone who is willing, and that willingness is improving, we have Reiki healers coming in. Somebody wants to do a particular therapy. Like I was just saying, there's a guy who's got leukemia who did not want to take any chemotherapy, and we are supporting him there while he's taking homeopathy and treatment from some Baba in Alwar. And when his platelets fall, we give him platelets. When his white cells fall, we give him marrow stimulating agents. So he is improving. He is actually improving, because every day we are doing visualizations with him. We are clearing his bone marrow. He's attacking his bone marrow through various ways, and there are ups and downs. But it's been 6 months now, and normally he would have sort of died within the month, the type of leukemia, acute leukemia he had.
What percentage of these cancer patients, when they're treated with these alternative therapies,
we don't do these audits really to know exactly the percentage, but the percentage is increasing, let's say, and the faith in people wanting to do these therapies are definitely increasing.
Okay, thank you.
No, because adults are, conditioned. They've got conditioned in their behaviors over the years, and then that conditioning keeps them in that emotional state. Please remember this analogy, this feeling, thinking analogy, that they have got addicted to that emotional state. They don't want to change. They're afraid to change. So because they're afraid to change, it's like taking computers, Adults are so difficult to learn computers, children will do miracles with them, And that's because they're not conditioned anymore. So when adults are conditioned to live in this emotional state, they become addicted to their suffering, they become addicted to their misery, they become addicted to their pain. And that is why you need to. So all you need to do is to, create an understanding with them, and that'll work. Or you just need to change the way they're looking at life. You see, when I talked about how the body starts to feel the way I'm thinking, the body becomes the mind, right? Now, to overcome this, I have to think greater than my body. So I need to change that state of my mind. So that needs to be inculcated through instruction. No, you ask them to participate. You ask them, like I said, you ask them that what, in your opinion, is your problem. What do you need? What is the message, like I said, your body is giving you? What does your body need to heal? You ask them to participate. And when they come up, or you ask them to write a page of their feelings on a daily basis. It'll work.
Anyone else?